Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
Now, I promise I won't go too much into data, but these three graphs were just so impressive that I feel like it would be very good for patients to have a quick look into what exactly are we as clinicians so excited about. Now, Teclistamab, Talquetamab, and Elranatamab are the three bispecifics that are now available commercially. And the three big clinical trials that looked into these three drugs also looked into how many patients are responding and how well are they responding. So what I want you to look is how many of these patients are having what we call stringent complete response, which is complete response with no evidence of even light chains, complete response, which is the middle section over here, partial response. So in myeloma, when we treat a patient who has significant disease in their blood or significant disease in the form of an extramedullary disease, what we are always looking for is shrinkage of their tumor if it's an extramedullary disease, or if they have measurable disease in the blood, we want to see what is called as at least something that's better than a partial response. So the good responses that we always look for are anything that's better than a partial response, and this is called a very good partial response, or VGPR, a complete response, or a stringent complete response. Now, these are terms I'm sure that as patients you may have heard from your physician. So we are really happy that when a patient's cancer is progressing, the drug we give is able to elicit a response anything better than a partial response. So these three drugs, Teclistamab, Talquetamab, and Elranatamab, was really, really successful at inducing really deep responses in patients who were heavily pretreated, in patients who had seen many drugs before. So roughly speaking, all of them showed like an overall response rate of anywhere between 60 to 70%. And 60 to 70%, I like those odds because these odds are in patients who have seen at least, at minimum, 4 different lines of treatment. And at maximum, there were patients who were enrolled in these trials who saw up to 12 different lines of therapies. Now, again, flashback to 2021, when these options were not there, patients who were heavily pretreated, when we give them a next line of therapy, our best hope was somewhere around 25 to 30%. So in the exact same population, to get response rates of 60 to 70%, that's great. And that's why a lot of us are so excited about these drugs now becoming more available. Now, I promise this, I will simplify this chart. And this is, again, a quick table that is showing a lot of the pivotal bispecific antibody trials and some of the data surrounding them. I will just be mostly focusing on our FDA-approved products, which are Elranatamab, Teclistamab, that's Elranatamab here, Teclistamab here, and Talquetamab. Again, when we look at clinical trials, there are 2 or 3 big things that we look for. 1, what patient population are we treating? 2, how well are the responses coming in? And we look at that with something called as overall response rate. And 3, and most importantly, how toxic is this therapy to patients? So what we found was that, across these trials, across all these trials, and mind you, we typically do not compare trials head to head like this, but this is just for a comparison's sake, for displaying all these bispecific antibodies which are given in the same space. So for all these trials, the vast majority of people who were enrolled were triple class refractory, meaning they had previously seen an anti-CD38 monoclonal antibody, a proteasome inhibitor, as well as an immunomodulatory drug. So again, these were people whose cancers had seen a lot of drugs before. So that's good because that's exactly the kind of patient population we would be treating anyway outside of a clinical trial. So that's great. Now, looking at the overall response rate, again, Elranatamab was showing in the initial magnetism trial, an overall response rate of 64%. Teclistamab was showing in the Majestic trial 63%, and Talquetamab was showing an overall response rate of 74%. And look at that. This Elranatamab 64% was in a population that was 91% triple class refractory. Now, across these three bispecific antibodies, it was only in the Elranatamab trial that they started allowing people who had prior BCMA-directed therapies like belantamab mafodotin or any CAR-T therapies. The duration of response, again, was excellent. A lot of patients had an excellent duration of response, more than 1 year to 1.5 years, and that's great. And the safety signals, a vast majority of patients had cytokine release syndrome, infections, neurotoxicity, and these were all in the 60 to 70%.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.